Hello to everyone. I'm very pleased to welcome you here in the parallel session on public health leadership, driving trust and transformation. I'm Heli Laarman from the Ministry of Social Affairs of Estonia, and I'm the head of Public Health Department. And today, in this parallel session, I'm co-moderating it with Dr. João Breda, who is the special advisor of WHO Euro regional director, and he is also the head of the Office of Quality of Care and Patient Safety in Greece, Athens.
Good morning, everyone, and welcome to our parallel session on public health leadership, driving trust and transformation. We are delighted to have already such a big audience here, and thank you very much for my co-chair for the really very kind introduction. Today, I think I would like to use 3 words. It's share, trust, and leadership. So these are things that we are really going to discuss in the context of the, of course, health systems transformation ongoing in the countries of the WHO European region, but with a particularly focus on public health and the role that we believe that public health leadership actually has. So we will try during the session to explore strategies to navigate this complexity, foster inclusivity, how we can sustain political commitment, how to drive innovation, to the examination and sharing of real-life examples, which I think is one of the strong points of our session here today, the things that you are doing in your own countries, many of them which are truly innovations. And innovation, as we know, goes far beyond digital. So many social innovations we've seen in the field of public health in the last years. We really would like also the session to focus a bit on the leadership skills and the creation of enabling environments for public health professionals and public health transformations. We will also highlight one of the WHO Europe initiatives on promoting public health leadership, which is our already famous leadership, WHO European Public Health Leadership course, which is already gearing up for the 3rd edition, and we will tell you a bit the story about that. And for that, I would like to really invite our first speaker with a short keynote introductory presentation by Professor Sonia Dias, my dear friend, Dean of the National School of Public Health in Portugal, in Lisbon, Nova University, and which, by the way, we are discussing how our school in collaboration will be co-hosting the 3rd regular edition of the WHO European Public Health Leadership course. So Sonia, over to you. Thank you very much.
Thank you so much. Good morning, everyone, and thank you, João, for the great opportunity to present the European Public Health Leadership course. So to give you an overview of the importance of conducting a leadership course, we know already that public health challenges are really complex and multifaceted. And so understanding the drivers of this challenge, but also the policy to tackle them, requires public health informed leaders, but also leadership informed public health professionals. And so it's very, very important and key to training and develop competencies and innovative approaches to address these complex issues. The idea came from the European Programme of Work, United Nations for a Better Health in Europe, and indeed this programme clearly underscores the need to strengthen the capacity of public health leaders today, but probably most important of the public health leaders in the future. So the idea was to organize a course, like Dr. João has already mentioned. WHO Region Office with the Italian Institute of Health conducted a course in November 22, and it was amazing that from the beginning the course has almost 40 participants from 20 countries, and the course has 3 weeks, 2 online and 1 residential in Rome. And more important, I think, it's that besides the technical aspects in terms of public health issues, the focus was given on leadership competencies, like, for example, communication and problem solving. The main activities, and was also quite innovative in terms of course methodologies, were that the course has learning sessions, but also experimental learning activities and social activities as a way of also building the team building competencies. And the course was very well evaluated. And this did indeed improved and enlarged the motivation to conduct it a second course that it conducted this year in Bordeaux with the WHO Region Office for Europe, with University of Bordeaux in collaboration with several institutions. And in fact, based on the feedback given by the participants, the course this year had 2 weeks, 1 online and 1 residential. And it was amazing because the participants increased a lot. So the course had 53 participants involving 32 countries, what it was really a big success. And even more because it was able to include 16 participants from 8 African countries. And here it was really important because besides the technical and the leadership aspects, it was also the course also covering the value in leadership. And that's why the course now calls enhancing competencies, embracing values and empowerment, evidence-based decision to become public health leaders. So I don't have much time, but I think you will discuss this further. The course was based in WHO and ASFER Public Health Leader Competencies Framework. And so the course used a lot case studies with the main content topics of the challenge in WHO region, but also the case studies were an opportunity to develop the competencies, for example, like system thinking, ethics, and emotional intelligence. So the program was a broad spectrum, as I mentioned, about public health focus sessions, as well as panel discussions, but also an opportunity to develop issues like communication or conflict resolution, mental health in workplace, that are really important to improve the insights for future leaders. So, based also in the previous experience, this year the course has focus sessions, problem-based learning, coaching sessions, but very, very important, the social activities, giving a broader picture of effective leadership. The blended format was also very well evaluated, allowing participants to get to know each other online and then preparing for the in-person week. The working groups were also very important, an opportunity to know each other and to have more confidence to go into complex issues. And some social activities were also developed, as I mentioned before. So the participants overall evaluated very, very well, and they were more than 97 were satisfied or very satisfied with the course, which I think it's a great success. This is some example of the discourse of the participants. He mentioned, in addition to the high quality of the lecture and speakers, a participative and collaborative atmosphere was created very quickly, and I could really feel in a safe space for learning. So what's next? So giving the memento, and it's very important to have this special idea, alumni online platform is being organized where the participants will stay in contact and participate in side events, exchange knowledge and other activities. We are also organize first national and sub-regional courses in Kazakhstan and Ukraine. But most important that we would like also to announce today is that we are organizing the next edition of the course in Lisbon. So the idea is that in collaboration with the European region WHO, the National Institute of Health and the Nova School of Public Health, National School of Public Health, we want to organize the course, and indeed this is something that our school, the National School of Public Health, are very much interested, because we have three main areas for developing, and we want also to contribute in health systems in a way that we could also leading the way to a healthy future. We have three main areas: transforming public health workforce, public health innovation hub, and developing more healthy communities. And indeed, this course links very well with the idea of transforming public health workforce. We have here several ideas for developing. We are organizing an international bachelor degree in global public health, but this specific course will link with the lifelong training academy that we are developing. And in fact, our students and public health workers are very much asking for developing leadership competencies. So this course will be very, very important at European region, but also in Portugal. And in another way, we are also trying to link with the community of Portuguese-speaking countries. So that could be also quite interesting to also strengthen the competencies of leadership in public health in Portuguese-speaking countries. And that's the main ideas. Let's maintain the course alive. It will be a challenge, but based on the feedback, we are very much motivated to have a more innovative program next year. So thank you so much for your attention. And now I invited you to see a video regarding this course. Thank you so much.
Thank you.
It is very much important for us that we build bridges between countries.
I think this course in public health is very valuable for all of us participants. From my point of view, the most important is diversity of the different professionals who are participants, and also diversity of different points of view.
I really enjoy that we meet so many people from different countries, but also from different sectors. Even though we all work in public health, we do have different professions and also different interests and angles to see global health issues, and that's what I like. I actually got a lot of different perspectives on things, so I don't only use my toolbox I have, but with the presentations I've heard and also the different speakers, I think it gave me new ideas that I can actually implement to my daily work.
Being in the Ministry of Health, I am the leader in the public health sector, so I have to use all the skills that I acquired.
This public health leadership course will benefit me on my day-to-day work, but also in the long term, I think. It will definitely give me confidence when discussing public health challenge in other politics than health. And it will also give me tool in my day-to-day work to interact with my team, but also with the other stakeholders that are working in health, but not only in health.
This course in public health is very valuable, and it will help me for sure in my future work as a health attaché in Geneva. I will try to transfer all information to my colleagues there in Geneva. So I believe that this information will not help only to improve our work on Euro regional level, but also on the global level.
I found the course very enriching. For me, it was a very positive experience that I would recommend to everyone who has interest in public health.
Thank you, Sonia, for this innovative way for approaching the course and of course, inspirational presentation you gave to us. If we want to achieve better health outcome, then it's obvious that we need also strong leadership in public health. We need leaders who are inspirational, committed, caring, and also evidence-based, and encouraging the whole population. And of course, such kind of courses would help us to build up a network to support such kind of leadership. So it's a very good way to go further. We have invited here also panelists to discuss a little bit further. And I would like to introduce briefly all panelists before starting discussions. Here we have Ute Teichert. She is the head of Directorate General Public Health at the German Federal Ministry of Health. She is the medical doctor and a specialist for public health. During the COVID pandemic, Ute had a leading role in advising the federal government of the public health services response to the pandemic. She was driving force behind the government's decision to adopt Pact for the Public Health Services to strengthen public health services in Germany. Then we have Karaman Hagverdiev, who is an experienced medical doctor, over 30 years of services in health sector, and he heads the Center for Public Health and Reforms of the Ministry of Health in Azerbaijan. And during the COVID pandemic, the Public Health Center played a significant role in the ministry's working group monitoring all activities, creating treatment protocols, and so on. And then we have Breda Smith with us. She is the Chief Medical Officer in the Irish Department of Health, leading the provision of evidence-based public health advice. Her work has included the response to the COVID pandemic and monkeypox. Then we have Lars Münter. He is dedicated champion for health literacy and self-care in Europe, working both across Scandinavia and Europe for 20 years on knowledge sharing and joint platform to promote health literacy, empowerment, and citizens' actions. As director of international project in the Danish Committee for Health Education, he works for practical path and systems leadership. He acts also as communications lead for the Nordic Health 2030 movement and the Wellbeing Economy Network Denmark to help deliver change. And the last one is Katharina Reich. She is the head of Section 7 Public Health and Health Systems. She is the Chief Medical Officer of the Austrian Federal Ministry of Social Affairs, Health, Care and Consumer Protection. During the pandemic, she additionally chaired the Corona Commission of the Ministry and was the Federal Vaccination Coordinator. Thank you a lot for being here with us. We would start with Ute. Ute, can you tell us more about the Pact of the Public Health Services to strengthen public health in Germany?
Yes, of course I can. That's why I'm here. Good morning, everyone. Dear colleagues, thank you so much for the invitation. I would very like to introduce you to our main topics in Germany, but let me first thank you for this informative framework you set with the public health leadership course. I think this is a very important tool to strengthen public health leadership. We want to talk about it later, but this is my comment, and thank you so much. It was lovely, yes. And now I want to start to talk about the public health reforms in Germany. You just mentioned it's a challenge, and we are still on the way in Germany, but we learned a lot from the corona pandemic, as all of other countries too. And we have two major reforms in Germany. One is the Pact, we just talked about it, the Pact for Public Health Services. And this Pact was created in 2022 from the former Chancellor Angela Merkel. She gave us 4 billion euros to strengthen public health services in Germany. And this means that at the end of 2026, the Pact runs about 5 years. We will have 5,000 more additional positions in the public health services. And you have to know, in Germany, the public health services are only 1% of the health workforce. So 5,000 positions more is amazing for us. It's really a push. That's very important. And with these new positions, we want to push the public health forces on the community levels, because most of these positions are in the regions, 90%. And this is very, very important. And the Pact has two components. One is the personnel and the public health forces, to strengthen them, and for 5,000 positions. And the other component is to innovate the digitalization, because this was also a problem during the corona pandemic. The public health services were not digitalized enough to produce the data we needed during the pandemic. And we are on the way. At the middle of the Pact, now we have established 2,750 positions. And we look forward that we can achieve these goals, because this is so important for us. And this is the one reform we made, and we think that it's so important for us to strengthen the public health services. And that's why I'm so interested of the course of the public health leadership, because we must give them an orientation. These new people who are working now in the public health forces. And our second reform is to build a new institute, a new public health institute. Perhaps I can talk about it later, but this is also very important, because these are two components and they are linked together. That's very important for us.
Thank you.
Yes.
Thank you very much. I have to say, Dr. Teichert, I mean, it's impressive, because the level of transformation that you are injecting in the system is amazing. And we talk a lot about change, but here is really doing on the ground, right? Increasing the workforce and public health, 5,000, 9 out of 10 going to the regions is absolutely fantastic. And your tone, putting the tone on the aspects of leadership and also innovation, I think is very important. As public health practitioners, I think we all understand that we need more innovation. The system has been stuck for many, many decades, and it really needs an injection of that innovation, where I'm delighted that you put leadership at the top, while acknowledging the challenges and all of that we all have. But it's really I mean, transformation in motion, so it's fantastic. Good luck. We hope we
Thank
can
you.
work
It's
together
so
on
important to start, yes, and to
Yeah.
continue, yes.
and political support, having a pact that is
Yes.
overarching is really great. Okay, thank you for that. Let me now invite Dr. Garaman from Azerbaijan. Azerbaijan is also taking forward a series of very exciting transformations in terms of public health, and we would really like to hear from you about all the interesting things that are ongoing in Azerbaijan. Over to you.
Thank you, Joel, for invitation. Azerbaijan healthcare system has undergone significant changes over the past 3 decades, with major reforms beginning 5 years ago. One of the major changes is implementation of the mandatory health insurance since 2021, which has significantly improved access to medical care, reducing almost by half of the out-of-pocket expenses and tripling the volume of care. Indeed, it's very big achievements. One of the main challenges has been that is fragmentation. We have 3 major players in the health sector. The Ministry of Health, in charge of overseeing the healthcare system, focusing on public education, medical education, research, and disease prevention and pharmaceutical issues. The State Agency of Mandatory Health Insurance that finances all services, and at least administration of the regional medical divisions, it's named TABIB, it's a new organization in our country, is charged to ensure the organization of medical services, subordinate medical institutions, and to take measures to improve the quality of medical service, providing medical service across all healthcare providers. Reducing fragmentation and promotion integration is a major ambition of the top level of government of Azerbaijan. In fact, it has gotten presidential attention and a presidential decree mandated to work towards reducing such fragmentation, streamline roles and reduce conflict, and establish the center of healthcare transformation. One of the most pressing issues is a shortage of qualified health workforce, especially in rural areas. The shortage is largely due to most medical facilities and specialties being concentrated in the capital city, Baku. This leads to staff overwork and a decline in quality of care. The shortage of qualified health workers is compounded by the aging of the existing workforce and the migration of Azerbaijani medical professionals, including recent graduates, to countries like Germany, Turkey, in search of better working conditions and better salary, of course. In Azerbaijan, doctors typically retire after the age of 65. But considering the current shortage, there is even a proposal to increase retirement age. As mentioned yesterday by our colleague from Moldova, things are changing, and we see some health workers are now returning to Azerbaijan, enticed by government-offered salaries comparable to European standards. Efforts are also being made to optimize the work process, adopt innovative solutions, including digitalization, and reduce the burden of our already stretched health workers.
Thank you, Karaman, for sharing your experiences and what is going on in your country. But let's turn to the Ireland. I know that in Ireland a lot is going on, Breda, and I know that you have also reforms there. And it would be good to hear more how you are managing to promote partnership and collaboration and to build trust with other sectors and other levels in government.
Thank you very much. Thank you. Yes, in Ireland, we are undergoing a significant public health reform programme. This had actually started pre-pandemic and it has been accelerated and magnified than during the pandemic and with the findings of the pandemic. So prior to the pandemic, there was a review of public health practice and our public health workforce with a report called the Crowe-Haworth report. With that was accepted by government and by our health service, and that identified a lack of public health leaders within our health system. So although we had public health specialists, they weren't being identified as leaders within our population screening programs, within our chronic disease programs, within our prevention programs, and it was primarily imbalance towards health protection. So the Crowe-Haworth process then went about designing the reform model of care for public health in Ireland, which was across the 4 domains of public health. So it was health improvement, health service improvement, health intelligence and health protection. And it was to rebalance the emphasis of how our public health was being delivered in our country, and also aligning our public health leaders to these domains of public health. Then, during the pandemic, I suppose every country had to respond to all things health protection. And once again, it gained the limelight. But within that, I think we all learned that during the pandemic, the real drivers of transmission and of illness and of burden of disease were our health inequalities and our vulnerable populations. And those were at greatest risk, which further emphasised the need for health improvement and also health service improvement. With that in mind, during the pandemic, another review was carried out of the public health service and public health in Ireland. And the recommendations of this was that we required a new public health strategy, but also to develop an agency for emerging threats, pandemic preparedness, and infectious diseases. So we are now, with regards to recruitment, we have increased our multidisciplinary workforce throughout our public health teams by almost 300 people, and these include nurses, doctors, also surveillance scientists, epidemiologists, data scientists. In addition to this, then, our public health doctors have gained parity with our other clinical colleagues. So previous to this, they had an inferior grade than our cardiologists or our respiratory consultants. And because of the Crowe-Haworth process, they have now gained equal recognition and remuneration as our other clinical colleagues. So these are elements that are driving the reform programme in Ireland, and we now have the implementation of the new model of public health with 84 consultants will be completed in recruitment by the beginning of next year. Through all of this, I suppose, in order to gain trust and confidence, communication has been key, and there has been significant engagement and communication throughout the entire process, and also co-design. So all the public health population were engaged in the co-design of the new reformed process, and that will be further reinforced with the public health strategy. Thank you very much. Thank you.
Thank you. Thank you so much. Again, congratulations for the transformative spirit and the drive to really change things by doing it really in a very practical way. I mean, lifting public health doctors, it's very important. Recruiting more people. This is really putting the investment where your mouth is, and that's very important. But I was more impressed even by your humble acknowledge that you recognize that we found there is a lack of public health leaders, right? And I think that is reassuring for us that we are trying to really also highlight the importance of this topic. Rebalancing the different dimensions and the tone on equity, I think this is really fantastic, and we are very grateful that you accepted to share that with us. And I believe that maybe sometimes back in the past we are maybe cousins, so it's very, very rare to find someone in another country with the same name as mine, but on a personal note. Thank you, thank you. Thank you very much for that. Now I'd like to give the floor to Lars. Lars is representing here, he's a member of civil society from Denmark, but also operating in Scandinavia, you know that in Denmark and these countries, civil society has a very strong role in terms of making sure that public health, but in particular health literacy, is really taken very seriously. So we would really like to hear from you about your experience. Thank you.
Well, thank you, Xiao. And obviously it's a bit tricky to be here on stage with people that have already begun the path towards trust and transformation. It's much easier to debate with someone who is unwilling, so that you can really shine a light as a beacon of hope. But you are shining a light, beacons of hope in your respective countries, and that's really cool. And speaking of that, maybe also the element that what we're doing in the Nordic Health Transformation, Nordic Health 2030 movement is really to try to use a North Star to know where you want to go, so that what you do is navigation and not firefighting. If you know where you want to go 5, 10 years from now, the chance of you getting there is much higher than by, having to jump over every loophole that you've come across at this stage. But specifically though, my advice here is, for instance, for what we've heard today, or yesterday for that matter, to use the assessment or the OECD WISE tools towards well-being, and to send all of your colleagues to Sonia's course, because that's of course one where it doesn't have to be only one, it has to share it in your organization, but to really make an effort in sharing that across your organization. And when we think about public health, remember that public health really requires public participation, public co-creation. It's not something that we do to them, or for them for that matter, but with them. It requires new tools and skills. It's not in first, but I really like David Ortiz mentioning the element about using the social media. And this is a skill. It's not something that you simply watch someone else using. You have to use it too, to understand the mechanism. The same applies for using elements of psychology, communication, analysis of different kinds. And thinking about that what you do as a system is not just about how you can transform all your hired shipmates into a new direction, but also who you can motivate into a different direction. And when we're talking about leadership, leadership doesn't mean that you're Henry V, that you're leading your troops into battle. It might mean that you're a coach or a motivator, a catalyst, that your role as a leader is something else than being ahead, but you're definitely part of the process. And then to remember that civil society and youth participation are really then a tool that you can use. The complexity that you're trying to do is something that you can do with someone. They really want to help. They really want to do stuff. What we've heard with the One of Us, how many ambassadors like Trolls have you sort of engaged? He takes on his T-shirt with pride, and as a mental health ambassador, it doesn't have to be paid for it. We have FC Prostate football teams in Denmark, where football players, prostate patients, happily go across the pitch because they're being rehabilitated. They don't think of it as rehabilitation, they think fun. Engaging schools in creating well-being data. They really want to know more, they want to be engaged. The mental health platform, we have actually the Ministry for Health in Denmark to creating a co-created platform for mental health in the workplace. The companies want to do stuff. They want to be engaged. And finally, as a more different kind, it's not about mental health, but about antibiotic resistance. How about asking everyone in your country, what are you really doing to reduce antibiotic consumption? Leadership, catalyst, but engaging those different elements that they're already doing and lifting that up at a national scale. That's at least for a first starter. And then maybe just to add, that this is not about creating data to use in a spreadsheet that you can have as a machine. This is a community of dedication. And as long as you can lead, motivate, catalyze that dedication, there's a lot of energy in the room, aside from who you actually need to pay.
Thank you, Lars. I think these thoughts were very useful just to see how we can also think out of the box and find more stakeholders who could advocate for the health and be our partners. And also the co-creation of health is very important. Thank you. Now, Katariina, could you share with us from the Austrian side experiences and particularly on the key success factors for sustaining political commitment for the transformation and the investment needed to strengthen the public health workforce, particularly leadership competencies?
Yeah, Heli, thank you for your question. Before I would answer it in detail, I would like to briefly outline the reform in Austria and a feature of the Austrian healthcare system that makes health reforms a little bit difficult sometimes on the one hand, and on the other, but helps to sustain commitment to the reform once the basis for the reform has been established. So just a few weeks ago, we finalized the framework for our public health reform, and it's the biggest structural reform in Austria so far. We secured the legal basis for its implementation over the next few years, and today it's going on in the parliament, so I'm curious about the final. It took us more than a year to negotiate the terms of the reform, and however, the legal basis is now in place, hopefully today, and it's very likely that we will not see any big changes to the key points of the reform over the next 4 to 6 years, because the stability is thanks to the fact that the current reform has been done indulging the adoption of many laws within our financial equalization process, the Austrian sweet spot for starting and securing any health reform, where every 4 to 6 years the federal government, the federal states and the municipalities negotiate the distribution of the federal tax revenues. So therefore, this is a feature, a key success factor for the implementation of the reform, and it will allow the stakeholders in the health sector to work on a certain extent independently of the future political commitment to the reform. Nonetheless, the political commitment will be important for the transformation. It's necessary, and in my view, key factors for the sustained political commitment are knowledge and trust. Knowledge, evidence and framing of the current need to transform. The need to transform must be and remain part of the political and societal dialogue, and this can be achieved through political, professional and civil society events and resonant framing that help to steer these dialogues. And second, we need strong institutions, stakeholders and the civil society playing an important role, as well as their interaction and cooperation. Both sides, government, facilities and civil society should learn from and support each other, and the coordinated efforts to maintain political commitment are usually very fruitful and can help us to build trust in this public health workforce. And the third key factor I would like to mention is networks. First and foremost, networks of professionals that include people from all areas and levels, and that promote this trust between people with different and maybe also conflicting interests. And speaking of networks, it's also essential to involve the private sector, the business community, as much as possible in the reform process. And then, to give an example, in Austria, we established a Future Health Lab to give this creation space. It's a neutral and independent platform for collaboration to interact. And of course, we need data systems and availability of evidence. It's a key to sustaining this commitment. And we need capacities, resources, and the people who know how to deliver and to achieve the mentioned before key factors. And in a nutshell, I'm coming to the end because my time is over. It's very important that we, as the leaders in the public health workforce, must trust and support young leaders. We must equip them for the challenges that lie ahead, particularly by allowing them to participate in and experience how we currently live leadership. And future leaders, and we can create the conditions for the public health workforce to thrive and to do the jobs as well and as easily as possible.
Thank you, Katariina. Thank you for bringing up such important factors as knowledge, trust, and networks. And of course, the importance to see also the possibility of young people to bring additional value to our work. But let's take some questions or thoughts from the audience as well. Any reflections? Yes, please.
Please identify yourselves if you don't mind.
Yes, Elke Jakubowski. I'm currently working with the Federal Ministry of Health with Ute Teichert and WHO. And I have a question to you, Katariina. You mentioned the Future Health Lab.
Yes.
Could you elaborate a bit more on that? Because it sounds like a really, really fascinating idea to give space to discuss and grow.
Yes, it's called lab because we want to try something. Everything we develop is always established in our ministerial systems, but sometimes we need to have the possibility to come together with people who normally not are invited to the in the ministerial setting, like business partners, like Sozialversicherung, insurance, and we need to have a space to think open-minded. And the lab is not the ministry. It's a lab where we can try, where we can talk about, and where we can develop new ideas in another setting. Yeah? So we are in the first steps of this lab development, and maybe it's possible to develop it really quick. Because we need this space, and we need new ideas, and also a place for these young leaders.
Please.
Hello, my name is Caroline Kostongs. I'm working for EuroHealthNet, and thanks a lot for all your interventions. Really very interesting to hear. I think it's really important for public health leaders to get the capacity and the time and the resources to work with other sectors, because that requires a lot of efforts. And I'm particularly also thinking working with legal instruments, because we need to move more and more on addressing the commercial determinants of health to see how we can deal with the health harmful industries. And then legal skills are needed, and I would like to hear maybe from Ireland, because you were successful with the labeling on alcohol, for example, and the pricing on alcohol, and what your experiences there are. Also, it's important for public health leaders to understand financial tools. You mentioned taxation in Austria, but I also know that Austria has been instrumental in using the resilience and recovery funds from the EU for example, community nursing and for mother and child activities, and but also looking at how can impact investors and investments, because there's a lot of money out there, and how can we channel those monies towards public health. And there are tools like health impact bonds or social impact bonds and social outcome contracting. It's all very complicated, but I do think as public health professionals and leaders, we need to understand the finance sector and the tools there and the mechanisms, taxation and legal, as well as the other sectors like environmental sector, social sector. So it's really quite a lot. And I do think that building capacities and strengthening resources of public health people in those areas are important, and I was wondering what your reflections are on this topic. Thank you.
Maybe you could.
So thank you very much. I will take the question with regards to the alcohol labelling. So this required, I think, significant engagement and consultation, but also to gain the trust of our government and my minister and my Secretary General with regards to the benefit of alcohol labelling, and also within our society in Ireland. We have quite a high rate of binge drinking in our young adults, one of the highest rates in Europe. So because it was a harm reduction measure, it enabled me to be able to put that evidence forward, but also the ability for our population to actually increase their awareness. It's really just informing people, you know, that this is a risk, and then it's personal empowerment with regards to the decision of whether they actually consume or don't consume. So it did gain significant resistance from the industry, particularly the alcohol industry, as you can imagine. However, with the support of the minister and then the government, who are very public health focused also, that we were able to actually get the bill signed, and now it's going through the WTO process. So it will be another 2 years before we actually get the labels on the bottles, but it is the first step. But I think it was going back to the evidence, and also Ireland has one of the highest rates of fecal alcohol syndrome in the world. So we had a significant public health issue that we needed a response to also, and that also, I suppose, helped the argument with regards to ensuring that we could get it across the line. Thank you.
And Katarina, maybe you would like to?
No. I don't think I can add any more because,
okay.
Yeah. I was already spoke already.
One short comment. You mentioned so many important topics. We have to think about it and we have to push it forward, and that's why we are we follow the public health and all policies approach. I think this is one solution. We have to roll this out. Health and all policies is very important, and it's touches all the points you mentioned.
And Lars, you wanted also comment?
Well, I really like the idea of formalizing something like the Future Health Lab. It clearly is a mechanism that can be used for good. I would encourage maybe to, if you do something similar across your countries, to also invite something like design thinkers and urban architects that has a completely different mindset, and maybe also finance specialists. Finance modeling is something that definitely can be included. There's a lot of good things being done within climate financing that might be used in the health sector as well. But we rarely, finance people are odd, right? So at least here is an opportunity to, in a safe setting, to talk about them. But if we pick up on in the plenary session earlier about the role about trace indicators, how about having trace indicators that, for instance, also how many ambassadors for mental health did you engage last year? Or how many singers did you hire? Or how many dance instructors did you engage? How many, motivational speakers? How many social media trainings did you do? There's a lot of elements to being the public health leader that's also goes with some of these skills. And if you can lead people, again, you don't need to be at the forefront, but you can use these as trace indicators, at least to say whether you have employed some of the other skills that you're, missing sometimes. The Future Health Lab is a really cool idea, yes.
Mm-hmm. Yes, and maybe this Future Health Lab could be also international. Why only national? So a lot of think about it.
Let's go small steps before.
We have another question here from the audience.
I'm Anne Johansson. I'm the head of the WHO country office. It's not so much a question, but a plea to which Lars really prompted me to make, which is we really need a transformation in how governments think about their role when it comes to changing people's behavior. Because what we hear all the time is, oh, it's people need to change their behavior. They just need to be more strong-willed. And the finance minister will certainly say, that's not our ball. What we need to recognize is the social or the behavioral sciences, that all the things that are required to change people's behavior, those things require public support in novel, transformative ways, so that you have health insurance funds supporting in innovative ways, for example, by doing block grants or something to municipalities to support innovative health promotion, mobilizing, exercising, competitions, all of these things, and that the government needs to think about creating the kinds of platforms that support behavior change for patients, for these. So there's a whole new set of thinking about what's the public's role in creating the platforms that we need and financing them.
Yes, I think that it's very, very interesting what you brought up, and sometimes I feel that maybe we are also underestimating the importance of living environment. It's also a kind of way to push a little bit what kind of choices people are doing. And of course, behavioral scientists should be more involved in policy making in general, and how to engage different sectors so that they can understand that health can be benefit for them as well. It's a challenge for us, but maybe here Ute and then Lars.
Yes, I think this was very important that you pointed out the behavioral cultural insights approach. We are just looking to this approach. I told you we are planning to build a new public health institute, and there we want to change the health communication with the population. And that's why we're so interested and so thankful for WHO and the behavioral cultural insights, because this is the base for us to go forward. Thank you.
Please, and then Lars.
Sorry, just another example of that is, I think that it almost needs to be iterative and continual, because we find that, say, during the pandemic, we were doing ongoing surveys, and it informed us with regards to when to actually reinforce interventions. You could tell by the level of fear in the community whether there would be compliance with the recommendation, and that guided our public health recommendations, because it outlined whether the population were ready and receptive to something. They were looking for something and looking for support and looking for leadership to tell them. I do think one thing within that whole sphere is the whole concept of it constantly evolving. Because I think that behavior change is very difficult, and it also needs to be constantly reinforced in innovative ways. So perhaps that's another element that can go into the lab down there.
Exactly.
But I do think that if we keep reproducing the same tools in the same way, then the population and individuals won't respond to the same extent. So it really does need to involve innovation also.
And then Lars.
Well, we've talked about maybe using public health leadership as a tool or an element in terms of talking to or with the public. But there's also the role of the public health leadership maybe in government. Innovative practices for health will rarely happen in the Ministry for Finance. So somebody needs to then pick up that particular element and maybe championing the element of the well-being economy within government. And who better place to do that than the Ministry for Health? To really sort of push for new KPIs and well-being that will enable a different type of economy. You won't find that from the Ministry for Finance, but you can do that. And leading or championing the work across community with the different stakeholders that are working with the well-being economy. That's also something that you can do. That would really also, they would welcome in the Future Health Lab such an initiative. Sure.
Thank you. Thank you. That's great. I think on this note, I think it's time for us to wrap up and close the session. I think it's really been super interesting, very exciting. I would like to share with you that for me, in a nutshell and 2-minute summary, I had 3 very strong impressions, feelings, if you allow me. One is really that's a lot, I felt a lot of energy in the room for this change and for this transformation, and I think it's very good. A lot of drive for change. We've seen so many examples. And also an innovation passion, which is when people think about public health as a field which is lost in time, actually. I mean, we can see a lot of passion here for innovation. And I think that was really good. And then I think I would suggest 6 points for our reflection and for the future, and maybe as a summary of this session. Change is happening on the ground, and there is work really in progress in terms of public health to promote trust and transformation. That's point number 1. Number 2, public health leadership, everybody acknowledges that's very important, right? And that we need new tools, new skills, things like being able to communicate, working with social media, and so many things that training these leaders. Leadership, you don't born with leadership. Some of us have more kind of natural tendencies for that, but it's trained, it's developed, and we have to do that as part of the development. Leaders are really like this, coaches, as facilitators. Here and there as generals, it's also important sometimes, but leaders are somebody who can inspire. This is something we try to address really with the course. You've talked about also the need, that's my fourth point. It's commonplace to say we need other sectors, multi-stakeholder approaches, but it's so important to really highlight the issues related with the economic tools and so many other things that sometimes we, in our small world of public health, we tend to forget. So thank you for reminding us of that, because I think it's absolutely crucial. And then co-creation and participation. It's fundamental. This is the new public health. That's the public health of the future. The future and the innovations are there, not just on digital, but beyond that. And novel ways of engaging with people and the people we serve in particular, I think is very important to promote their well-being. And I would like to finish with this word, well-being. It's the public health of the future, I would say. So thank you for that, and let me just thank my colleagues who helped really very strongly set up this session. One of them is here with us, Emilia, in the room. Please raise your hand.
Thank you, Emilia.
Vini, who is our wonderful comms person. She's not here, but she did, as you may agree, a great job with the video. Thank you very much, and see you around. Thank you for joining us. Thank you.